뭐
아니
뭐 브이로그 처음 해봐?
아니 그냥
오늘 뭐 하지? 오늘 hype day. What's hype day? What does it stand for? Alright, say it again. What does it stand for?
Healthcare Interprofessional Education.
Nice. Okay. Alright, we'll take a quick tour because tomorrow we're doing it, right? Yes. So we'll take a quick tour of all the settings. 자, 이렇게 좀 필요한 것들. applesauce, gauze, temperature probe, 37 degrees. What's this? 97 to 94. My heart rate is a bit high. Okay, second bag. One of the first things we do when the patient comes to emerge is hydrate them, get an IV going, and get a saline going. Okay. Blood pressure cuffs. We always want to make sure that their blood pressure is adequate, and we always have to monitor them. These for ABG, arterial blood gas. So you get an IV site going. Like for example, let's say you have an IV here. You draw blood, boom, attach this little cap, put it on, and push it up, and it'll be filled with blood. This gets sent to the lab, and we can analyze patient's blood gas. And this is an isolation room. So basically, if the patient has any transferable disease, they will be in an isolation room like that. And we would have to wear our PPEs to protect ourselves. Alright, reports, go.
Report, 31-year-old male who has GI bleed and he also has a PE, pulmonary embolism, so control PE with oxygen, so we'll give oxygen, which the RTs will do, and then once GI bleed's controlled,
Put him on anticoagulants. Yes.
Like he said.
This is the future of Canadian nursing. Shit. Alright, so the day has started. We have around 70 people in the room waiting. I think we're gonna start off with the icebreaker. Quite a bit of people actually.
So for today, we have a gentleman named Mitch Jordans. He's a 31-year-old male that came into the hospital with GI issues, ended up having a scheduled GI resection for 0500. So in the early morning, he had a GI resection, so they're doing abdominal surgery. Right now, we had no significant past medical history or family history. Some slight complications with the GI surgery. So was left on some quite heavy anesthetic. After post-op, they decided to keep him anesthetized and bring him into the ICU to slowly wake him up. And they anticipate, they're hoping for no issues, but they do anticipate maybe some slight complications along with that anesthetic. Okay, questions for me at all?
It might be trending compared to there.
That once again, I want to say good work on organizing yourselves and taking that step-by-step approach with a team lead and assigned roles to kind of tackle the full assessment for this patient. So excellent work.
So there's an ABG arm there. If somebody feels like they need to do a blood gas, you can draw a blood gas out of that arm. We're going to have 2 standardized patients. These are real people, okay? They are not sick dolls. You can't injure them. You can't stick needles in them, obviously. They're going to be talking to you, okay? Now, they're both female standardized patients. They have a gown on. They have undergarments on. This is one of the objectives of this station is examining the patient. So you've got to leave their undergarments on. You need to examine. All of you should have some skills of basically doing some sort of a history, however you're taught, some sort of getting a story from a patient. I don't care if you're med lab or if you're in ultrasound or what have you. You're still going to get a bit of story. And you need to examine a portrait classification. For the actual, and so part of the, as I say, one of the objectives is assessment.
You're in pain, so let us know. Okay?
ATM does have a issue with the chat.
Yeah. So we need to do, either way, we have to do a head control straight from the top.
I'm an ACP student. My name is Becca. I'm an ACP Year 1 student.
I'm Ryan. I'm an ACP student. There is no years. It's not even a year program, so. But I'm Ryan.
Yeah. Okay. Let's see who we got here. Nursing students. Raise your hand. Nursing? Yes. Awesome.
I'm going to be picking on you guys a lot.
Open and clear. Is she able to talk? Does she have snoring respirations? Are there other things going on? As we can see, there's quite a few things that can go wrong with the airway right away, and that's not a good thing. If something's wrong with A, we want to fix that. So, you know, it can be as simple as just like a nice head tilt chin lift to relieve some snoring respirations, and it can move all the way to having to RSI somebody because they can't breathe, which is never good.
Yeah, so if this person has an occluded airway, right, we're going in with Miguel forceps, we're either trying to pull something out.
Yeah,
Worst case scenario, we're trying to stuff it back down so we can at least get half a lung.
That's all we're looking for.
Yeah, so going back to, sorry, just the back one there. So even with the, so like the advanced life support, right? That kind of gets its name from the advanced cardiac life support, ACLS. I'm sure you guys are familiar with.
Bilateral, you're hearing coarse crackles throughout.
Course crackles? Okay.
Yes, I'm in the right.
Okay.
I can't seem to get anything out.
Has he had an x-ray?
No x-ray has been done.
No x-ray's been done? Okay, well, we're gonna order an x-ray
Sure, we'll get on that.
for the dog.
It's okay.
And the main
X-ray
thing
tech
that you're
comes.
gonna do is
Here, we've come.
Oh, okay, cool.
So you're gonna, what are you doing?
The arm is being used, so, but she's on the way. Can I just, she's on the way to do it? Cool.
Smooth. Yeah.
That sounds like
Is it 15 and 2 for 30? Is it 15 and 2?
I don't know.
you can also jump on the bed.
We got it. Thank you very much.
Okay.
So here's your blood work. Once it gets here, hold on.
The long axis, then that's going to become superior in the body, that's going to become inferior, anterior, posterior.
So this
The
is
orientation is always changing depending on how we're holding the camera.
So here we've got that short axis. So that little P, the blue P up on the screen, that's our marker. And that's right now, it is pointing to the patient's right.
Where's the
Right
On
there.
Oh, okay.
So that's where the line is.
This
Oh.
is her right, and this is her left. So yeah, this little, yeah. Okay. So, like Amy was saying, what we do is we, yes.
Play around with settings to take a look at different tissues, because tissue will all show up to a similar color of gray. The human eye can kind of see like 30 shades of gray. And so
They just get rid of that. They go
we can also put in markers if we want to.
Put in like some copy to disappear, this one appear.
Point things out. Yeah, if you're doing chest
Guys, they're stuck together. We will heat the sample up to 90 degrees, which will cause these two to split. We'll lower the temperature to about 50 degrees, which will allow more primers to bind. And we'll keep doing this for 35 to 40 cycles until we end up with an exponential value of DNA. With these DNAs, there's also fluorescence probes that will be attached to it. This is how we detect it, is through fluorescence. And that detection will come out in the form of a graph. So here's just a quick graph here. This has all of the positives on it. So these are mostly just